following portion of Bloom is sponsored by Bonneau Facial Plastic Surgery.
It's often said the eyes are windows into the soul. And when it comes to restoring a youthful look, your eyes are your greatest opportunity. Joining me now with more is double board certified facial plastic and reconstructive surgeon, Dr. Sumit Bonneau. Dr. Bonneau, it's great to see you again.
Thank you so much. Thank you for having me.
So, doctor, let's talk about the eyes and how you handle the hooded area that makes people look almost like sleepy and dragged down.
Sure. So the hooding that we get in our upper eyelids, there are really two parts to this story. Okay, the first part and the simple part of the story, I've shown this in my first case, is as we age, we get heaviness in our upper eyelids. We can all see this, we can pull on it, and it makes it hard to apply makeup. And that is usually addressed with the upper eye blepharoplasty, and with which we remove this, and you can see the results, eyes look refreshed. However, many times it gets a bit more complicated. And the reason is, and we could try this at home if you want to try it, the brow drops. And as the brow drops, you'll notice you get extra heaviness on the upper eyelids. So whatever happens with the brow, the aging of the brow affects the upper eyelid. In these scenarios, you have to do a brow lift and an upper eyelid lift to create this open, refreshed look.
And what about folks who want to deal with the under eye area?
Okay, so that's a lot more complicated, and this is where many times we get into trouble. So in the lower eyelids, let's talk about the anatomy. And the way the face is made is you have a bony skeleton, deep muscle layer, and these three outer layers of fat, fascia, and skin. And these are the layers that are actually sliding as we age. And as they slide, the volume in the upper face falls to the lower face. As it falls, it creates a deep hollow under the eye. It's like the rug's being pulled out from underneath the eye. In addition to that, a lot of ladies complain of a little bulge right there. And that bulge is caused by the partition that holds the fat back in the eye gets loose as we age. Okay? So the simple fix, many times if it's just a partition problem, you go in there and you remove a little bit of fat from this. And you can see this in the first case. You'll see there's a huge improvement in the eye. But if you really scrutinize this, you'll notice there's a hollowing of the eye to some extent. And so that doesn't completely address the problem.
Okay, so then what do you do if you can't completely address it with just the fat transfer?
Sure, that's a great idea. So that's actually done quite a bit, okay? It's very popular. People add fat to this area to fill in that void. So what I do is I do something different, because when you add the fat, you're adding extra volume on top of volume that's already fallen. You're stacking the volume, creates a little puffiness in the face, and changes the proportions of the face. So what is the problem? The problem is the volume has shifted down. So let's fix the problem. So I do a deep plane facelift, which is a rare facelift, and we actually shift this deep volume. We crowd the volume up under the eye where it used to be, and then I shift the volume in the eye into the tear trough, fixing that depression there, and now you'll see in these results that you create these eyes that look very natural and very rested.
And this is what you're known for, because typically plastic surgeons are pulling just the superficial skin back, and it almost has that windblown look. But by the deep plane, it's something completely different that gives a much more natural look, which is what people are looking for.
Correct. So it's a more restorative look, and the reason it's restorative and the reason it looks natural is we're restoring the proportions of the face. We're recreating what once was. That was the original beauty. We're recreating the original beauty. And of course, it looks natural because that's the way she used to look.
Doctor, thank you so much for sharing this with our Bloom viewers.
Thank you so much for having me.
For more information, call their office at 941-966-FACE. That's 941-966-3223. Or visit their website at SarasotaFacialPlastics.com. We'll be back with more Bloom right after this.
The preceding portion of Bloom was sponsored by Bonneau Facial Plastic Surgery.